Welcome to Shennu's Media Education's YouTube channel. Today we are discussing the Critical Care Nursing Test Paper 3 Part 3. Who are preparing for the staff nurse examination preparation? Questions and answers along with the explanation also I am giving. It is very useful for OET examinations in SNB, HAD and Prometric examination, NORCET, AIIMS and ESIC, RRB examination, ZIPMER examinations also it is very useful. UPSC, TSPSC, CHON, Kerala PSC also. This session was very important for who are preparing for competitive examination as a staff nurse, who want to crack any examination. Please watch this till end the video. The question number 1. The nurse has a prescription to administer packed red blood cells PRBCs to the client who does not currently have a intravenous line inserted. When the obtaining supplies to the start the blood infusion, the nurse should be select an angio catheter of a last which size? The correct answer is 19 gauge. The explanation of this question: blood components are usually administered with least of 19 gauge needle, cannula or catheter. The larger sizes 18 or 16 gauge may be preferred if the rapid transfusion or given a smaller needle can be used for the platelets, albumin and clotting factor replacement. The question number 2. The nurse is creating a plan of care a client who is receiving total parenteral nutrition TPN, which is assessment should be included in the plan of the care. The correct answer is blood glucose level every 6 hours. The explanation of this question: complications associated with TPN therapy include hyperglycemia and hyperglycemia and infection, fluid overload, air embolism and electrolyte imbalances. It is standard care to monitor blood glucose levels at 6 hours intervals to the assess for hyperglycemia. The third question: the nurse is performing an assessment on client admitted to the nursing unit who has sustained an extensive burn injury involving 45% of total body surface area. When the planning for fluid resuscitation, the nurse should be considered that fluid shifting to the interstitial space is greatest during which time is period. The correct answer is between 18 to 24 hours after the injury. The explanation of this question: the maximum amount of edema in a client with burn injury is seen in between 18 to 24 hours after the injury. With adequate fluid resuscitation, the transmembrane parenteral end restored to the normal within 24 hours to 36 hours after the burn. The remaining options are incorrect. The fourth question: the nurse is carrying a client who is sustained multiple fractures in motor vehicle crash 12 hours earlier. The client now exhibits the severe dyspnea and tachycardia and mental confusion, and the nurse suspects fat embolism, which is initial nursing action. The correct answer is position. The client is follows position. The explanation of this question: client with fracture are at risk for fat embolism. With suspected fat embolism, the nurse would position the client in the sitting follows position to relieve the dyspnea. The supplemental oxygen is indicated to reduce the sign of the hypoxia. The primary healthcare provider needs to be notified vital signs will be needed to be taken, but this action may be delayed initial and required to interventions. Peripheral pulse assessment is not priority action. A neurological assessment needs to be performed, but this would be not be the initial nursing action. The fifth question: the nurse is monitoring a client who is require a Sangstaken Blackmore tube because other measures for threatening bleeding esophageal varices were the unsuccessful. The client complains the severe pain absorbed onset, which is nursing action is must be appropriated. The correct answer is cut the tube. The explanation of this question: spontaneous rupture of the gastric balloon, upward migration of the tube, and occlusion of the airway are possible complications associated with the Sangstaken Blackmore tube. Esophageal rupture also may be occur and characterized by the abrupt onset the severe pain. In the event of any of these life-threatening emergencies, the tube is cut and removed. The sixth question: a child is admitted to the hospital after being seen in emergency department with complaints of right lower quadrant abdominal pain, nausea and vomiting, fever and chills. The primary healthcare provider PHCP suspects appendicitis, which is assessment finding should be the nurse immediately report to the PHCP. The correct answer is sudden relief of the abdominal pain. The explanation of this question: a sudden relief of the pain from the suspected appendicitis is commonly indicative a rupture of the appendix. This places the individual at the risk for peritonitis of the shock. The PHCP should be notified immediately because of the need of the begin intravenous antibiotic to prevent further the complication. Although the increasing complaints of the pain is a concern, the higher priority is sudden relief of the pain because of the risk of the peritonitis and shock. Temperature should be monitored but is not a highest priority. A child will be placed in an NPO, nothing by mouth status in the anticipation of the surgery, therefore of the option 3 is incorrect. Seventh question: following infusion of the unit of the packet red blood cell, the client has developed new onset tachycardia, bounding pulses and crackles and wheezes. Which action should be the nurse implement the first? The correct answer is place the client in high follows positions. The explanation of the question: now onset the tachycardia, bounding pulses and crackles and wheezes post transfusion is evidence of the fluid overload and complication of associated with the blood transfusions. Placing of the client is high follows upright position will be facilitate breathing measures that increase blood return to the heart such as the leg elevation and administration of the IV fluid should be avoided at the time. In addition of the administration of the fluid cannot be initiated without the prescription. Counseling with the PHCP regarding the administration of the oxygen may be necessary, but positional changes take a short amount of the time to end should be the initiated first. The eighth question: a client with no history of respiratory disease is admitted to the hospital with respiratory failure, which result on the arterial blood gas report that are consistent with this disorder should be the nurse expert to the note. The correct answer is PaO2 49 mmHg, PaCO2 50 mmHg. The explanation of the question: respiratory failure is described as a PaO2 is 60 mm of Hg or lower end PaCO2 is 50 mm of Hg or higher in client with the no history of respiratory disease. In a client with history of the respiratory disorder with hypercapnia increases of the 5 mmHg or more PaCO2 from the client baseline are the considered diagnostics. The ninth question. The nurse should be evaluate the defibrillation of the client was most successful if which observation was made. The correct answer is arousable sinus rhythm, arousable and sinus rhythm at blood pressure BP 116 by 72 mm of Hg. The explanation of the question. After defibrillation, the client required to continuous monitoring of the electrocardiac rhythm and hemodynamic status and neurological status. The respiratory and metabolic acidosis developed during the ventricular fibrillation because of the lack of respiration and cardiac output. This can cause a cerebral and cardiopulmonary complication also. Arousable status, adequate arousable status and adequate BP and sinus rhythm and indicates successful response to the defibrillation. The 10th question. A client in shock and receiving a dopamine hydrochloride by intravenous infusion, the nurse should be have which medication available in local injection if intravenous infiltration and medication extravasation occurs. The correct answer is pentolamine. The explanation of the question. Pentolamine is a alpha adrenergic blocker agent that prevents the dermal necrosis and slogging after the infiltration of the norepinephrine or dopamine, and vitamin K is antidote for warfarin. Atropine sulfate is a antidote for cholinergic crisis. Protamine sulfate is a antidote for heparin. Thank you for watching Shen News Media Education. For more videos, please like, share, subscribe my YouTube channel and follow on Instagram and WhatsApp and Telegram my Shen News Media Education YouTube channel. Thank you very much. Today we have discovered critical care nursing paper 3 part 3.